morning, class. My name is Sergeant Henderson. I am from the Nebraska Army National Guard, currently deployed here in Djibouti, Africa. I'm going to be going over how to apply hemostatic dressing. The overall class is unclassified today. Before we get started, I want to remind you of your safety first. Make sure you're mindful of your slips, trips, and falls. You know where your fire exits are or storm shelters due to unexpected weather. Just make sure that you are remaining hydrated throughout this class as well. Make sure to recycle, and then at the end of this class, just make sure you pick up after yourselves. Is there anybody on profile that I should know about? Nope. Okay. Task action today. It's going to know how to apply hemostatic dressing. Task order is 081-833-0211. Conditions today. So your squad is moving through a built-up area when your snipers open fires on the rear guard, striking him in the leg. Once the sniper has been eliminated, you will move back to the patient's position. He appears alert and is in screaming pain. A member from your squad is applying direct pressure on a large gunshot wound in the patient's lower right leg. You determine that this type of bleeding is best controlled by a hemostatic agent. You must apply hemostatic dressing to control the hemorrhage. Now, during this exercise, you will need a fresh, clean pair of gloves, a towel if you have one, gauze, and a pressure dressing as well. Standard today. At the end of this class and these instructions, you will successfully be able to apply an emergency hemostatic bandage to control the bleeding without further injuring your patient in accordance of IAW AR 40-68. Alrighty, so right here is going to be our injured leg where the soldier has been shot. So step one, you're going to want to go ahead and apply gloves. More sterile environment, the better, if possible. Some tactical situations, you do not have that opportunity. Alrighty, once the gloves are applied, we will move on to the second step. So right now you want to also identify, which has already been identified in the scenario, where the wound is at, and and make sure to expose the wound. If there's any excess clothing or anything, you want to cut around that so you have a better area and a better view of what you're working with. As the scenario said, it's his lower right leg. Here's both anterior and posterior view of that. And then you want to make sure when you get your good clear picture of the wound, you want to wipe off excess blood around the wound to kind of see better where you're working with. Just be mindful that you do not wipe away any clotting that may have occurred to where you don't want to have excessive bleeding to where the patient would have to bleed out again or apply a tourniquet. And also it helps risk with infection as well. So once you wipe that away, then you are going to go into the soldier's IFAC. I repeat, their IFAC, not your IFAC. The IFAC is used for you and you only. So you're going to go into their IFAC and grab their gauze. And there's two different types of gauze. The gauze I have right now is the standard gauze, but the gauze that we are looking for with the hemostatic clotting agent has a blue line through the middle of it, and that's what helps activate the clotting throughout the scenario. So what you're going to do is you want to apply pressure on the wound while you are grabbing the gauze. Once the gauze is in hand, make sure that you are remaining to hold pressure at all times. And then you have it open. You're going to take your dominant hand or what's more comfortable. You're going to form a full ball if you can. And then you're going to transition the pressure. You're going to pack the wound as much as you can while maintaining pressure with that already packed hand. Okay. There you go. Wound is packed. And then for step 5, you're going to go ahead and remain having pressure on there for a minimum of 3 minutes for that clotting agent to engage. If it does continue to bleed out, make sure you add more gauze as well. You also might have to go onto a tourniquet if the clotting agent hasn't worked. And then you would redo steps 1 through 5. After we've held for 3 minutes, it's clotted, everything looks good and stuff. And so you're going to start applying a pressure dressing. So right here, we're going to grab our pressure dressing. Most important part is you want to make sure where your wound is at, you are covering it with the sterile white part of the dressing. You're going to wrap that and have that centered right there. And as you wrap it around, you're going to continue to pull it tight. And then with this right here, you're going to go in at a 90-degree angle, turn and get that in there. This is where the most important part is. You pull it tight, and then you're going to go reverse. And that's what's going to give you that pressure that you need to remain having pressure on the wound after care is taken care of, or your care is done. So you're going to continue to wrap it around. And you're going to want it at least 1 or 2 inches over where the wound is at itself. Alrighty. And then here we go. Once we get to the end, you're going to have this little thing right here. It has little teeth on it. So you're going to go to the top layer. There you go. And then you're going to lock it in to where it doesn't adjust and it doesn't loosen up, and it's maintaining pressure on that. Everything looks good. Bleeding stopped. You're not seeing any excess blood coming out. So you're good for there. And then step 7, after you've got done getting the patient stabilized and stuff, you're going to go and fill out your Tactical Combat Casualty Care Card, which is known as a DD 1380. This is where you're going to write the soldier's name, rank, last 4, their unit, anything, if they're allowed, or if they have any allergies or anything, where they were injured, if you had to apply a tourniquet, what time, their blood pressure, and the time that was, to help keep track of whether they are stable or not when further help comes. And you can take or keep track whether they are stabilized or significantly getting worse. The last step of step 8, you're going to inform medical personnel who have arrived your findings, your treatment, and assist them with a further evac and requests as needed. Alrighty, so that is how you apply a hemorrhage dressing. Now we're going to do checked on learning. If you can find a partner if possible, we're probably going to take about 5 minutes for you and your partner or yourself to practice a little bit and see how you guys are doing. I will be going around the class asking you questions, different scenarios possibly, and see how you guys are doing, just evaluate the overall class. After that, we're going to have the remaining 5 minutes for any questions or concerns that you had, and anything that you were just curious about while working the exercise. Alright, congratulations, everyone has passed. The report is proficient. 21 soldiers in the class, 21 soldiers were proficient, and 0 untrained. Now I'd like to conduct an AAR if that's okay. Any sustainments, anything that you would like, any improvements on, any better ideas, what I did right, what you did enjoy about the class, anything really helps during these briefings. And then during this, no injuries occurred during this brief, and the overall risk assessment did remain low. Alrighty, that concludes the class today. I really appreciate and thank you for your help and attention in this class today. I hope you guys learned something, and you guys are dismissed and free to go.